Initially, it was really overwhelming, a lot of vendor choices. We were quite methodical about the way that we chose to do it. We looked for vendors that targeted our physician practice size. We narrowed it, obviously, but by budget first, and then we started looking at what options were wants and needs within that criteria. One of the things that we noticed first and foremost was a sort of circular design within the software, in that you don't have to leave a certain module before moving into another, and data is accessible from so many different places with a consistency of icon, and the layout is, it's just very navigable and easy to use. I've been very pleased. Being a rural health clinic, there are some things that are unique to rural health medicine and billing particularly. And so in a lot of areas, our needs were more complex than the typical provider. They were very receptive at times when an issue was complicated or more complex than the typical call-in. We would get assigned to a specific person that followed it through, and they would consult with other departments and bring in the appropriate pieces. And I think that consistency and willingness or eagerness to see resolution to problems is an impressive statement. Well, it completely affects your Medicare and Medicaid billing. With Medicaid, there are some very specific, there's a specific CPT code only strictly for rural health. We don't bill dollar amounts, and the way it's laid out is just very different. On the Medicare portion of it, we actually bill physician services on an institutional format, or the UBO for claim form, and it is very different, billed with a revenue code, and it's that Part A pays Part B services in rural medicine. So I think setting all of those things up, typically regular private sector physicians don't use a UB for anything. And I just have found that even when e-MDs wasn't completely ready for us, they were dedicated to making sure we got our needs met. That whole period is really intensive, and I think that now that I've had experience with e-MDs and other software vendors, I think often there's a disconnect between the end of the implementation that's assisted by the vendor and when we're actually going to be up and functional at that optimal level. And e-MDs did a great job. They assigned an EDI person, they communicated with ourselves and the clearinghouse and made sure some of those gaps were filled. And it was a nice experience, although there's still some aches and pains that go on during that time. I would probably tell you you're not allowed to talk to anybody but e-MDs. I have recently done some consulting work and had the opportunity to use other products and have had to learn them very quickly and on the fly. And the navigability, the way that it's easily modifiable. I know from the provider side at our practice, one thing he said is it thinks like I do. And the progression and charting flow is similar. And if a change needs to be made or a template needs to be created, it's not something you have to pay $180 an hour programmer to do. It's something he can do at his desk in his office, and it didn't take a lot of on-site time. Being a nurse practitioner only clinic and rural health, we have set the mark very high, and I think that the safety issues, all of the things, it's certainly increased our efficiency. We run with less staff, we run a tighter ship. A lot of our goals were to have no wait times, and our patients are just very content to be able to come in and be in an environment where things are smooth and flawless, and people aren't hunting paperwork and shuffling paper charts, and You know, a check-in is just seconds for a returned patient, and then they're in a room and very comfortable.